So Vidya, medical nutrition therapy, easily said, but how easy?
Yes, Emma. I heartily congratulate you as a DIPSI president and taking over this certificate course across Karnataka and maybe at the national level. And really thank you for inviting me for this important topic. And you all know how much interest I have in nutrition part. And we all recognize that the nutritional counseling or physical activity are the primary goals in the management of gestational diabetes. But it is very, very difficult to give this practical nutrition education and counseling, because it is mainly the family we have to educate, and mainly we have to educate first the people who are treating, the doctors. They don't recall on any. I think I have just done a survey, small survey. They don't record the weight or height. They don't record the BMI. And then the cultural, the behavioral pattern, and whatever the eating patterns, they differ. You know that the North Karnataka, the incidence of gestational diabetes, if we say, maybe because of their eating pattern, they are different. So we have to empower them to choose the right quantity and quality of the food. And then the follow-up is very, very important. I cannot have a good dietitian like Sheetal with me, but definitely I can have Hema's diabetic food plate for explaining. I congratulate you for that. Maybe Sheetal will throw more light on what to eat, what not to eat. And then when we become very rigid about the diet, it is very difficult them to follow, because there are a lot of cravings in the pregnant woman and they tend to eat more. So according to BMI, according to their cultural practices, and according to the availability of the food, we have to advise, and according to their status, we have to definitely advise, and this we have to teach. And maybe in your certificate course, I have a simple small place, small, no, it should be a bigger one, because we say that medical nutrition therapy
is the mainstay.
For any of the treatment. The physical activity also should not be forgotten. Simple physical activity for these women are very, very important. So healthy eating habit after delivery, even postpartum, the weight gain, all these things are very important things. And I congratulate you for the diabetic plate. I have not got it, but I simply draw it and ask them to eat the complex carbohydrates. I teach them about the carbohydrate exchange and whatnot. So it is a long, if I go on talking on MNT, I think I will take more time. So I stop here and I will give the opportunity to EG again.
Thank you. Thank you, Vidya, because, the Food and Drug Committee of, FOGSI made a tremendous mark during your time, because there were so many new issues that we got sensitized into, and the whole of Shield team is here. I had seen I had seen Mahadevan also join in the earlier part. Balaji is here, Senthil is here, Chitrakala, Stalin, Sahiti, and all of them. They will take this message forward with the plate, because they were waiting for an appropriate opportunity how to just percolate so that it just stands on the table of every single OBGYN. Easy to explain. So right from November 14th, the World Diabetes Day, to March 10th, the GDM Awareness Day, their journey with the plates will continue pan-India. I can promise it on their behalf, because they really mean to do their best to contribute in a very significant and an effective manner of what can be practically, properly utilized. So thanks again, Vidya. We need more help from you, because FIGO, Think Nutrition First, that's the FIGO checklist which we have worked on in the Indian context. And every single clinician has to fill up that FIGO nutrition checklist, take a dietary recall, understand what this patient is already eating, try and see how they can manipulate to the best of the capacity with low carbs and high proteins and a little bit of fats and low glycemic index and all of that. It becomes then easy to have that as a starting point. So thank you, Vidya.